To the best of my knowledge, the original study that was published in the journal The Lancet back in 1998 by Andrew Wakefield and his colleagues showed that there was a link between gastrointestinal distress and symptoms of autism disorders, and also a link between gastrointestinal distress and having received the measles, mumps, rubella vaccine. And what Andrew Wakefield concluded on the basis of this finding was that because A is linked to B, in other words, gastrointestinal distress is linked to autism, and because B is linked to C, gastrointestinal distress is sometimes linked to having received the measles, mumps, rubella vaccine, that therefore there must be a causal association between having received the measles, mumps, rubella vaccine and having autism. And one of the biggest problems with that kind of a conclusion, and one reason why you cannot make that conclusion, is that in science in general, you can never conclude that an association is a causal mechanism. That just because A is related to B, you can never conclude that A causes B. And especially when you have the case that A is related to B and B is related to C, you can certainly never say that A causes C, and that's exactly what Andrew Wakefield and his colleagues concluded in their original study. In science, if a study is published in a reputable journal, you're always given the opportunity to replicate the findings. In fact, science in general is a field of replication. One study is never the final answer in anything related to health or science. So once this finding was established in the medical literature, researchers for many years were trying to replicate the findings, and nobody was able to replicate the findings. In fact, in several studies that were published in the years following 1998, researchers actually not only were unable to find a link or find an association between autism and vaccines, but also showed quite clearly that the level of mercury in children with autism was actually equivalent to that in children without autism. And in fact, there was actually one study or two studies that actually showed that the levels of mercury in kids with autism was actually lower than the general population. Medical panels like the Food and Drug Administration sent out a notice saying that mercury should be removed from most childhood vaccinations, particularly the MMR vaccine, and it was. Mercury was removed from the vaccine over 10 years ago, and since that time, the rates of autism have actually been going up. And that shows even further that there's absolutely no link. So we just needed time. The scientific community just needed time to refute this finding. Make sure your child receives proper vaccinations. That will enable us to continue to have protection against very devastating illnesses like measles, like mumps, like rubella. If your child does have autism, understand that this is nothing you've done as a parent. We don't know the cause of autism, and that is one of the most frustrating aspects. This is a developmental disorder that, again, has an unknown origin and an unknown cause, probably genetic in nature, and that we're looking, as researchers and clinicians, we're looking at interventions that can be started early enough to really help out so that the course of the development of this disorder is, at least if not stopped, hopefully reversed in the future. We do know that the earlier you get your child into an intervention, into a well-known behavioral and cognitive intervention and social intervention, the better the outcome. One thing you would want to do is to go to local universities, go to local hospitals, see if they have intervention therapies for autism. Luckily for us at Hofstra, we do have an autism clinic. The clinic is headed by Dr. Kim Gilbert, and she does do interventions with social skills therapy, with cognitive remediation, with behavioral interventions. And these therapies are known to have effectiveness in many, many kids. North Shore Hospital and the LIJ Health System has what is known as the Linder Center for Autism. This is a very well-respected autism diagnostic and treatment center in the area. It is a federally funded center and a center that is funded by the North Shore LIJ Health System. The clinical head of that center is Dr. Joel Brigman. These are the centers that you actually do want to seek the help and advice.